And I have 5 more terms for you that are less to do with the crown of a tooth and more to do with its root. So an apex is the very end or tip of a tooth root. And the apical foramen is an opening at the end of a tooth root where nerves and blood vessels enter and exit through. Next term is furcation. And just like how a tree branch splits into two, some teeth have multiple roots, and that branching point or dividing point of a multi-rooted tooth is called the furcation. It's called a bifurcation if it branches into 2 roots, and a trifurcation if it branches into 3 roots. The cemento-enamel junction, or CEJ for short, is where the cementum and enamel layers meet on a tooth's surface. It's also called the cervical line, since it forms a line on the neck of the tooth, the part of the tooth right by the gums. And lastly, we have the root trunk. That's the area of a root between the CEJ and the furcation. Finally, let's apply some of the terms we just learned and give you some overarching trends and general features that apply to the entire permanent dentition. As far as teeth most likely to be missing, third molars are most common, then mandibular second premolars, and finally maxillary laterals. I know there's a lot of discourse around which of these two is most likely missing after the wisdom teeth, but this is the trend I have settled on being most accurate for patients in the United States. So that is what I recommend you study and memorize for the board exam. As far as tallest crowns, first is mandibular canines, then maxillary centrals, and finally maxillary canines. This one's interesting. All teeth are wider faciolingually than mesiodistally, except maxillary incisors and mandibular molars, which are wider mesiodistally. All teeth have a facial height of contour in the cervical third, except mandibular molars, which have their height of contour in the middle third. All teeth have their lingual height of contour in the cervical third if it's an anterior tooth, or middle third if it's a posterior tooth, except for those pesky mandibular second premolars, which have their lingual height of contour in the occlusal third. Generally, as you go distally and more posteriorly, the crown heights of teeth decrease, and for molars, the lengths of root trunks increase. Lingual embrasures are almost always larger than their facial counterparts, and that's to encourage the pushing of food towards the tongue. All right, so with all of that background, we're now ready to dive in tooth by tooth. So stay tuned for the next videos in this series.